Welcome to your medical unit huddle for August 9th. I'm Ricky, your nurse manager. For patient experience this week, I'm going to talk about the email I sent out about our NRC picker. The question being, did nurses listen carefully to you? The two main responses that we got for that question is eye contact and repeating back what the patient has said to you, not like a parrot, but that you have summarized what the patient has said to you. Lets the patient know that you are listening. The winners who actually read their email and got the points are Jess Young, Jocelyn, Kat, Michelle Benzer, and Michelle Snyder. So I'm guessing you guys are probably the only ones watching this video because it seems like nobody else looked at the email or they don't want points, whatever. Anyway, thank you guys for responding to that and giving our patients a good experience at and letting them know that you are listening to them. Also, whiteboards. I know you guys are probably like, oh my god, if I hear one more thing about whiteboards, but it's super important to the patient. We continue to see where the previous shift or two is still on the whiteboard. So please make sure that you make that a priority when you're going in, that you are updating who the nurse and PCT assignment is. And then, of course, nurses, if there's any updates to the patient's change in plan of care, that you guys are updating that. We do have something in the works that we're looking at revamping the whiteboard, so maybe it makes it a little bit easier, or the space is bigger, or that kind of thing. So know that that is in the works as well. All right, for Carly's Corner, for her updates on RLs for this week, two things came from our safety huddle. One, bedside report. Please make sure that you guys are reviewing the order at the bedside. That is the expectation. That means that you are going in and opening the chart in the patient's room. We will be starting audits, random secret shoppers, checking in to see who is actually going into the room and doing the bedside report. I will tell you, today, I had one person say to me, you know what would be really great is if we could do bedside report or implement bedside report, and I about fell out on the floor. So please make sure that you guys are doing bedside report. It is not okay for someone to say, oh, I don't need bedside report, or we don't need to go into the room. Yeah, you do. You need to go into the room because this is how we catch things, and you want to take a look at the patient with the other nurse, because for all the times that we think, oh, the patient looks fine, there might be that time that something has changed. So do your bedside report. And then consider the Prevalon heel protector boots for every patient on turn teams. Pillows deflate and are not sufficient to eliminate pressure on heels. We think that we're offloading the heels with the pillows, but maybe the patient's feet kind of slide off the pillow, or you kind of fold them over, they slide off, or eventually they deflate and they still are just resting on the mattress. So consider if that patient is appropriate for the protector boots, the space boots, All right, let's go to an email I got in regards to the black cords in the patient rooms that are now connecting to the beds. So I know this is a black and white copy, it's kind of hard to see, but you have this here. It's the magnetic quick disconnect cable. It's designed to connect to all types of hospital beds. They are changing out the cords on those beds. I am still waiting for some more information on just to help us kind of better understand what the purpose behind it was, but it is a magnetic connect. And I was informed, one little tidbit on that was that they are changing them out. So say it's an emergency, or even with transport, they're kind of pulling the cords in and out of the wall. This is a magnetic connect, so it should make it easier for those cords to disconnect. But every room should have one. I think there's just a couple of rooms that they haven't been able to switch those out. I'm going to leave this at the desk if you care to read any more of this literature here. Staff recognition. One, we didn't have any employees of the month for July, which makes me kind of sad. One, because I know that everybody is super amazing, and I'm sure that there's somebody that you could nominate, or you guys are like so busy that you're like, I ain't got time for that. So please make it a point to nominate your coworker that just made your day. We want to welcome Andrew and Carly, who have started. They are going to be full-time night shifters. Well, Andrew is. Carly's going to be day shift. Just kidding, Carly, if I scared you. But anyway, if you see these folks, welcome them, say hi. Congrats to Hannah, Rachel, and Lindsay. They have completed their 1 year of the new grad program, so congratulate them. I think that's all I have. All right, I'm going to turn it over to your charge nurse. For any current quality patient safety concerns, as always, I encourage you to subscribe to our MCR YouTube channel, and you guys have a great shift.